If you are a mature man and still have an independent sex life, I ask you to listen carefully. No one has ever told you this, but it could be exactly what is weakening your erections, lowering your sensitivity, and slowly undermining your confidence. Not because you do it, but because of how you do it. My name is Dr. Morrow L., and for over 30 years I have been helping men over 60 to recover energy, intimacy, and vitality. And I assure you that this is one of the most neglected but also most widespread aspects in my patients. Most think that masturbation is either healthy or harmful, black or white. But the reality is much more complex. And much more important than you might think. Because while on the one hand it can promote health, on the other hand, if practiced in the wrong way, it can slowly undermine your erectile ability, alter your hormonal balance, impede circulation, and distance you emotionally from those around you. In this video I will take you step by step through the 10 hidden dangers of masturbation after 60 that very few doctors actually explain. I will also show you how to turn this private habit into a useful tool to protect your prostate, improve blood flow, boost testosterone, and rediscover your connection with your partner, if you have one, or with yourself, if you feel lonely. Finally, I will teach you a natural 7-second technique that I recommend to my patients to regain strength and desire in a natural, safe, and drug-free way. If you are interested in this topic, leave a like now. Subscribe and activate the bell to receive new advice aimed at male health after 60. And in the comments write, "I'm taking care of myself, starting today." A small symbolic commitment, but profound. Now let's really get started. And let's start with what is rarely seen as a danger: the silence that isolates. Risk 1: Emotional and social isolation. One day I found myself in front of a 67-year-old patient, a retired professor. His gaze was dull, his voice thin, almost as if he wanted to apologize for existing. After a few minutes he said to me, "Doctor, I haven't touched another human being in months. But I continue to do it alone. Is it wrong?" That sentence struck me more than the practice itself. Because masturbation, in itself, is not harmful at all. When lived with awareness, it is part of sexuality. But when it becomes a substitute for intimacy, and not a support, the real problem begins. Many men over 60, 70, even 80, take refuge in silent and private routines. Autoeroticism becomes a shortcut to feeling something, even if only for an instant. And slowly, almost without realizing it, they stop looking for authentic intimacy. They stop looking for someone's gaze, a hug, a conversation, a touch. It's not just a sexual issue. It's a slow and painful detachment from life itself. From the desire to be seen, heard, desired. I've known men who, after years of this voluntary solitude, have lost all drive towards relationships, towards human contact. Not because they no longer need it, but because they've learned to give it up. And you know the truth that almost no one dares to say? Touch is medicine. It is dopamine, it is oxytocin, it is vitality. When you stop reaching out, your world shrinks. And not because you are getting older, but because you have stopped believing that anyone still wants to receive what you have to give. But it is still possible to change. Reconnecting doesn't necessarily mean going back to romantic dates or pursuing sexual relationships at all costs. It can start with simple gestures, calling an old friend, joining a club, exchanging a few words at the market. Intimacy is also being listened to. Feeling human. When you stop believing that you deserve the closeness of others, you begin to accept solitude as if it were freedom. But it is an illusion. Risk 2: Skin microlesions. A while ago, a 72-year-old man told me with embarrassment, "Doctor, I feel a burning sensation down there after, when I do it myself. It's becoming frequent." He was afraid. He didn't know if it was normal. Maybe, he thought, he was breaking something in himself. And the truth? It was neither strange nor rare. The skin of the penis, as we age, becomes thinner, more fragile, and slow to heal. Collagen production decreases, and the ability to regenerate is reduced. If combined with repetitive and perhaps abrupt movements, it can lead to the appearance of microlesions, small abrasions that are invisible but painful. These microtraumas often manifest themselves as redness, burning, hypersensitivity, or small cuts. And, if ignored, they can degenerate into inflammation, infection, loss of sensation, and even permanent scarring. The problem is not age. It's technique. You have to learn to respect your changing body. Always use a water-based lubricant, avoid aggressive movements, give yourself time. This is not an act to be concluded quickly. It is a moment of connection with yourself. It should provide relief, not discomfort. Remember, you are not doing it wrong. You are just using a method that is no longer suitable for your body today. Now that we've seen how your skin can be affected, let's talk about what you can't see but feel: loss of sensation. And how, without knowing it, you may be training your brain to no longer respond to real emotions. Risk 3: nervous desensitization. He was 64 years old. A bright, active, healthy man. He still worked part-time and lived an orderly life. But when he sat down in front of me, he was visibly uncomfortable. "Doctor, I can still do it on my own, but with my wife, I feel almost nothing. I feel like I'm not myself anymore." He was shocked, but not by an illness. He was shocked by the fact that his body no longer responded to true intimacy as it once did. And it's more common than you think. When a man always masturbates in the same way, same position, same pressure, same rhythm, maybe always in front of a screen, the brain gets used to it. A neural shortcut is created, like a groove that water always follows the same way. That's where the so-called desensitization is generated. Pleasure becomes something automatic, conditioned to a single modality. Over time, this leads to a depletion of sexual response with a partner. It takes increasingly intense stimulation to reach orgasm, and in some cases, without those exact conditions, you don't get anywhere. Once upon a time, a look or a touch was enough. Today it takes a whole tailor-made scenario. But it's not dysfunction or impotence. It's neuroplasticity. It's the effect of years of the same old habit. And, fortunately, it can be reversed. The key? Vary. Change the pressure. Change the position. Change the mental images. Try to use imagination instead of visual stimulation. And most of all, slow down. It's not a race. It's not an escape. It's a journey. The male brain is capable of reactivating sensitivity if you allow it to explore new paths. And it is not weakness. On the contrary, it is a sign of maturity to learn to enjoy with awareness, and not only with impulse. Many of my patients have managed to rekindle passion with their partners after years of distance. Not with drugs, but with patience, listening, and new methods. Because sensitivity is re-educated. You are not broken. You have just been trained in a direction that is too narrow. Now you have the opportunity to broaden the road. And if desensitization can rob you of the fullness of pleasure, the next risk can lead you to ignore vital signals from your body. Signals that could save your life, if you know how to listen. Risk 4: masking erectile dysfunction. A man in his 60s, in excellent shape, walked into my office. "Doctor, I'm fine, I go to the gym, I eat healthy. But I stopped looking for my wife. Alone everything is fine, with her, no way. So I gave up." His voice was calm, almost resigned. He hadn't realized that his body was sending him an SOS. Here's the thing: an erection, for a man, is much more than a sexual act. It is a barometer of vascular, nervous, hormonal health. If you can do it alone, but not with a partner, you may be dealing with early erectile dysfunction. Perhaps linked to microproblems with circulation, insulin, testosterone, or neuropathy. But since masturbation is easier, less engaging, less complex, you feel like you have everything under control. In reality, you are just avoiding the obstacle, instead of facing it. And in the meantime, you may overlook the early signs of diabetes, hypertension, or vascular insufficiency. All conditions that, if caught early, can be treated. And often they resolve without invasive drugs. That's why I always advise my patients not to wait for disaster. If you notice a change in the quality of your erections with a partner, but not alone, talk about it. Don't hide it behind autonomy. Because that little crack can lead to a serious problem. You are not weak for asking for help. You are wise. And a wise man faces the signals of the body, not silences them with shortcuts. And if we're talking about signals, the next one comes from something even simpler: your posture. Yep, that's right, the way you sit can hurt your pleasure more than you think. Risk 5: nerve compression due to incorrect posture. I remember a patient telling me, "Doctor, I feel a strange numbness in my groin. It's not pain, but something is wrong." He was 70 years old. He was not diabetic, nor hypertensive. But he had compressed nerves. Not from trauma, but from the way he sat. Many men masturbate while sitting, perhaps in hard chairs, with their backs hunched, or in a squatting position. This, over time, can lead to compression of the pudendal nerve, which controls the sensitivity of the penis, scrotum, and pelvic floor. The result? Gradual loss of sensitivity, tingling, discomfort, pain after the act. And here too, we often immediately think of hormones or age, but the real culprit is mechanical. The good news? It can be fixed right away. Avoid prolonged sitting or hunched positions. Prefer lying down positions, with a pillow under your knees to relieve lumbar pressure. Take breaks during the day, stand up, walk, stretch your back. Your nervous system needs oxygen and freedom. Sexuality is not just instinct. It is also posture, circulation, breathing. When you learn to listen to your body even in the details, you discover that you can recover much more vitality than you think. And if the body demands respect, the mind does too. Because the next risk does not affect the sexual organ, but the emotional heart. The risk of transforming masturbation from pleasure to escape. Risk 6: using it as your only emotional outlet. One day, a lonely man, a widower, said to me, "You know, some days are empty. I don't feel like thinking. And doing so turns everything off." He didn't talk about desire. He talked about pain, loneliness, absence. And masturbation, for him, had become a release valve. A kind of button to pause feeling. And deep down, I understand. Because genital stimulation releases serotonin, oxytocin, prolactin. It makes you feel calm. For a moment, it makes you forget. But if it becomes the only valve, it can become a trap. It isolates you even more. It makes you skip meetings, phone calls, invitations. It becomes an emotional sedative, which, however, in the long run, distances you from life. There's nothing wrong with seeking comfort. But if that's the only way you deal with emotional fatigue, then it's time to broaden your options. Walk. Talk to someone. Do something that gets you moving. Ask for help. Create healthy routines. And if you can, seek out human interaction. You don't need a relationship, just a connection. Because orgasm comes, but does not fill. Only human connection does that. Risk 7: Guilt and hidden shame. He walked slowly into the office, eyes downcast. He was 72, a former pastor, with a gentle, almost fragile voice. When I asked him about his sexual health, he paused for a long moment and then confessed, "I still do it sometimes, but then I feel dirty. I can't even look at myself in the mirror." This form of shame, so intimate, so silent, is one of the hardest burdens to bear. It was not born today. It was born decades ago. From rigid teachings, from inflexible religions, from families where pleasure was a sin and the body a taboo. Those voices made room in the mind and remained there, even when no one repeats them anymore. So many mature men experience sexuality as a secret to be hidden, as something that disqualifies them as moral beings. But I want to tell you something clear, strong, and without hesitation. There is nothing wrong with touching your body with respect. Desire does not fade with age. The need for contact does not expire. Intimacy is not a concession of youth. It is a human function, always valid, always legitimate. And when practiced with awareness, it can also be a form of healing. The problem isn't what you do. It's how you judge yourself for doing it. And that constant judgment can raise your cortisol levels, disrupt your sleep, lower your mood, even reduce your ability to experience pleasure. If every time you indulge in a moment of intimacy with yourself you punish yourself internally for days, you are damaging something deeper than the body. You are undermining your dignity as a human being with normal needs. The first step is not to change your gesture. It is to change your gaze. Talk about it. Write about it. Talk to a psychologist, a therapist, a doctor. Break that mental cage built on rules that you no longer need today. Because you are a whole man. You are not broken. You are not inadequate. You just need to give yourself permission to be vulnerable too. And if shame can hurt you inside, the next risk is about a pain that manifests itself outside. Literally in the body. A feeling that many ignore until it becomes a real weight between the legs. Risk 8: Pelvic congestion. He was 68, a single man, a widower for a few years. Since he retired, the days had become slow, all the same. "Doctor, I don't know how to explain it. It's not real pain. It's as if I always had a weight down below. A constant pressure." He had already done tests. The prostate was normal, no infection. But there was one element that clarified everything: he masturbated several times a day, almost every day. Not because of excess libido, but because of boredom. To calm the anxiety. Because that way he felt at least for a moment occupied. What he was experiencing had a precise name: pelvic congestion. Pelvic congestion is a condition in which the pelvis remains in a constant state of stimulation and blood flow, without having the necessary time to recover. The walls of the vessels become inflamed, the tissues remain swollen, the sensation is that of a weight, of discomfort, sometimes even of a dull pain in the testicles or in the pubic area. The issue is not how much you do it. It's how much time you give your body to rest. Especially after 60, recovery time is crucial. The circulatory, hormonal, and nervous systems need balance. You are not less virile if you give yourself a break. You are wiser. Because you give your body time to regenerate. Many men feel guilty if they fail every day. But they don't have to. Pleasure doesn't expire. You don't have to prove anything to anyone. Pelvic congestion, if ignored, can become chronic. But if recognized early, it often resolves with a simple rule: moderate the frequency. Listen to your body. Slow down. And you will discover that, often, less is more. Because when you return to pleasure after a break, you rediscover it deeper, more intense, more authentic. And if the body needs recovery, fertility, for those still looking for it, also requires attention. Because yes, even after 60, you can still be a father. But only if you learn not to waste energy when you need it most. Risk 9: Impact on sperm quality. A 61-year-old man, recently remarried to a younger woman, told me enthusiastically, "We are trying for a child, doctor. It is our dream." But after 6 months, still nothing. His tests were fine. Hormones normal, cardiovascular health stable. But when I asked him how often he ejaculated, he replied lightly, "Almost every day. Sometimes twice. It helps me relax." And this is where many men go wrong, even with the best intentions. Frequent ejaculation, while not harmful, can temporarily lower sperm concentration and motility. Especially after age 60, when sperm production naturally slows down, the body needs more time to recharge. It's not about abstaining forever. But if your goal is fertility, then giving your reproductive system 2 to 5 days between ejaculations can make a difference. It's a simple way to improve sperm quality, increase your chances of conception, and optimize your resources. Because fertility isn't just desire. It's also strategy, timing, and respect for biology. And the possibility of giving life, at any age, is not just a physical fact. It is also a testimony of your vital energy. The one that does not fade with the years, but strengthens if cultivated with intelligence. But there is one last risk, perhaps the most insidious of all. It doesn't affect the body. It affects the mind. And slowly, without you realizing it, it can alter the way you see yourself and those around you. In recent years, among the many requests I receive from my patients, there is one that comes up more often than all. "Doctor, is there something simple, natural, that I can do on my own to regain my sexual strength?" The answer is yes. And it has nothing to do with miracle pills, expensive supplements, or invasive procedures. We are talking about a simple, powerful, effective gesture. A technique of only 7 seconds a day. A micro practice that can contribute to improve erection, stimulate blood flow to the pelvis, reactivate genital sensitivity, strengthen the pelvic floor, awaken the connection with your body. And all this, without the need for a partner, without stress, without shame. What is this technique? I call it conscious pelvic floor contractions, but you can also think of it as intimate muscle awakening. It's an exercise that works the muscles of the pelvic floor, the same ones involved in erection, ejaculation, and the sensation of pleasure. Think about when you stop the flow of urine while urinating. The muscles you activate at that moment are the ones we will focus on. These muscles, with age, tend to become dormant, weaken, lose tone. The good news? They can be reactivated. With little effort. With great results. How is it practiced? Phase 1: Comfortable position. Sit on a straight-backed chair or lie on the bed with your knees bent. Your back should be relaxed. Your shoulders should be soft. Phase 2: Slow breathing. Close your eyes. Inhale deeply through your nose for 4 seconds. Hold for 2 seconds. Exhale slowly through your mouth. Do this for 2 or 3 breath cycles. Phase 3: The contraction. Now, without moving your legs, buttocks, or abdomen, just contract your pelvic muscles. The ones you would use to hold pee. It should be a sharp, short, but intense contraction. Hold the contraction for about 7 seconds, then relax for another 7. Repeat 3 times in a row. Phase 4, listen. As you contract, bring your attention to the area between your anus and scrotum. You will feel a slight activation and energy moving. This is your power point. No visible movements needed. No tools needed. Just awareness. When to do it. The ideal time is in the morning, just after waking up, or before going to sleep. Just 21 seconds of active exercise is enough to start awakening a dormant circuit. And after 10 to 14 days, many men report faster and more stable erections, greater control during ejaculation, increased sensitivity, better perception of one's sexual energy. But it is not just a matter of physiological results. This gesture is also a symbolic act. It is a way of telling yourself, I'm taking care of myself again. I still deserve pleasure, strength, vitality. You are not just an aging body. You are also a man who can evolve. And every conscious gesture, however small, is a seed of rebirth. What is it really for? Many think that virility is measured by performance. But what really distinguishes a conscious man is the connection with his body. When you practice this exercise, you not only strengthen an area essential for sexuality, you reactivate the dialogue with your deep nervous system. You reconnect. You wake up. You recover. And slowly, masturbation can go back to being what it should be, a moment of care, not an automatism. A sensory experience, not an escape. A conscious choice, not a blind habit. Recap, your new 7-second ally. Find a comfortable position. Take a deep breath. Contract your pelvic floor for 7 seconds. Release for 7 seconds. Repeat 3 times. Do it every day. It doesn't matter how old you are. It matters how you live them. And if you choose to begin this practice today, you are already changing your relationship with your body, with pleasure, and with aging. You are giving yourself permission to feel again. And that, believe me, is pure power.